Hello everyone, I'm Sangeeta. Today's topic for discussion is alcohol metabolism. Alcohol or ethanol, we know that which we used to consider it as a drug. It has a high energy content that is nearly 7.1 kilocalorie per gram energy on oxidation can be get through the alcohol metabolism. Alcohol has the same molecular structure as fuel like ethanol, CH3, CH2OH, and we know that it is poisonous to the human body. Many of the effects associated with consuming alcohol are actually as a result of either the toxic impact of the alcohol on the body itself or the body's method of coping with the toxin. When we consume alcohol, immediately the body will tries to eliminate this alcohol. And we know it is acting as a drug and can form both dependency and addiction. So in this slide, which explains the overall pathway of alcohol or how the alcohol is getting digested and absorbed. First of all, from mouth and esophagus, alcohol is diluted by saliva before being swallowed. That means some of the alcohol can be immediately absorbed from the mouth itself. Then stomach. More alcohol being absorbed here and which can cause irritation to the lining of the stomach and increasing the acidity. Then small intestine. Any remaining alcohol can be passed here and is a site of most alcohol absorption. Then coming to the bloodstream. Once the absorption done, alcohol quickly diffuses through the body and affecting almost all the cells. Even the alcohol can cross the blood-brain barrier and can affect the central nervous system. And liver being the major metabolic organ, blood alcohol is metabolized in two stages mainly that we will be explaining in the metabolism, and finally the product acetate can be respired into carbon dioxide and water and can also utilized for the synthesis of fatty acid. And the alcohol can be excreted through the urine, lungs and sweat also. So while going through with this pathway itself, we can understand that the mouth itself, the absorption or the utilization of alcohol is getting started, which explaining the overall effects of alcohol. Okay, so regarding the metabolism of alcohol, it is very easy. Only two enzymatic reactions are involved. That is, through the liver enzymes alcohol dehydrogenase, which is a cytoplasmic enzyme, and aldehyde dehydrogenase, which is a mitochondrial enzyme. So these two enzymes are the major enzyme which helps to metabolize the alcohol. And alcohol metabolism via the alcohol dehydrogenase producing a secondary product that is more toxic than the alcohol. That is why in previous slide we have explained that either alcohol itself or its toxic byproduct can cause serious effect to the human body. So this byproduct is actually acetaldehyde, that is alcohol oxidized by alcohol dehydrogenase enzyme to form acetaldehyde. Then acetaldehyde is then converted into acetic acid or acetate by aldehyde dehydrogenase enzyme. And this acetate can be digested into fatty acid or it can enter into completely break down into carbon dioxide and water can enter into TCA cycle. Okay, and the fatty acid when digested can create 7 calories per gram of alcohol. That is why I told the alcohol can yield about nearly 7 kilocalorie per gram energy on oxidation. Okay, these figure which explain the steps involved in the metabolism of alcohol. You can see two enzymatic reaction, that is alcohol dehydrogenase and aldehyde dehydrogenase. Initially, ethanol or alcohol undergoing alcohol dehydrogenase reaction, that is oxidation of ethanol to form an intermediate. It is highly toxic, that is acetaldehyde. But this acetaldehyde can immediately undergo in another oxidation by aldehyde dehydrogenase enzyme to produce acetic acid. Okay, below you can see another thing, that is methanol, the oxidation of methanol. Methanol is also an alcohol, but it is more potent or toxic than the ethanol. So methanol by the enzyme alcohol dehydrogenase undergoing oxidation to form formaldehyde. Remember, this formaldehyde is more dangerous than acetaldehyde. That is why methanol can cause methanol poisoning than the ethanol metabolism. Okay, and for the methanol poisoning, ethanol can be used as an antidote. And this formic acid again oxidized by aldehyde dehydrogenase to form formate. Formaldehyde undergoing oxidation to form formic acid or formate. Now, we have seen one liver enzymatic system which help for the oxidation of alcohol to acetic acid. Here, one more enzymatic system is there. That is second one. Most of the ethanol which is metabolized by a mixed function oxidase system, that is known as microsomal ethanol oxidizing system, which is an alternative mechanism for the detoxification of alcohol. And it is an inducible enzyme. What is the meaning of inducible enzyme? That means while consuming alcohol, but the presence of alcohol causes the induction of this microsomal enzymatic ethanol oxidizing system, and which help for the oxidation of alcohol. And it is a cytochrome P450 dependent enzymatic system, which is a secondary enzyme system for the ethanol clearance. Metabolic tolerance of alcohol in chronic alcoholics is responsible. This microsomal ethanol oxidizing system is responsible for the this what to tell metabolic tolerance. Okay, because in chronic alcoholic there is an increase in this microsomal ethanol oxidizing system. That is why metabolic tolerance developed for the alcohol. And the ethanol oxidized in liver microsomes to acetaldehyde by mixed function oxidase system. Okay, so these two are the enzymatic reaction help for the oxidation of alcohol. Now, coming to the important point, what all are the biochemical alterations in alcohol? Okay, this figure which explains the complete thing, I will explain one by one what all you can follow the red arrow. So the increased alcohol metabolism cause increase lipogenesis or more fat. More fat can cause the accumulation of more fat in various organ, like it can leads to like fatty liver, cirrhosis, etc. And in both the enzymatic reaction, the previous slides you have seen, the more production of NADH, both aldehyde dehydrogenase and alcohol dehydrogenase leads to the production of more NADH. More NADH can cause the conversion or reduction of pyruvate to lactic acid. So lactic acid accumulation can cause acidosis, and even the excess fat or excess level of acetyl coenzyme can even lead to more accumulation of acetyl coenzyme, and depletion of oxaloacetate can lead to ketosis. And all these things can even lead to hypoglycemia. Let me explain one by one. So first of all, the high NADH level because of the two enzymatic reaction can lead to the reduction of pyruvic acid to lactic acid. Okay, so it can lead to lactic acidosis. And second point is hypoglycemia. Why there is hypoglycemia here? Decrease the availability of gluconeogenesis, resulting in decreased rate of gluconeogenesis and decreased synthesis of glucose. Okay, so the available pyruvate is converted to lactic acid because of the high NADH level, and also it leads to the conversion of oxaloacetate to malate. Okay, so in both way, what will happen? There will be depletion of oxaloacetate, and depletion of oxaloacetate can inhibit the gluconeogenesis. That is why hypoglycemia occurs in alcohol metabolism. Next, the ketogenesis. Ketogenesis here, because again the high NADH-NAD ratio can cause decrease pyruvic acid, because pyruvic acid is always going for the reduction to lactic acid, and decrease oxaloacetate also. So this high NADH level causes the suppression of TCA cycle. So what will happen? There will be accumulation of acetyl coenzyme this acetyl coenzyme A can cause even increased acetyl coenzyme A can cause even initially we told that is ketosis, and also the increased level of acetyl coenzyme A can lead to increased fatty acid synthesis, but at the same time there will be inhibition of beta oxidation and also TCA cycle. So what will happen? The acetyl coenzyme A will be accumulated in liver and that channel towards the synthesis of lipid or fatty acid. So this fatty acid or TG will be accumulated in liver, that is known as fatty liver. Okay, so together all those things promotes the lipogenesis, TG synthesis and cholesterol synthesis from the acetyl coenzyme A, and that leads to fatty liver. Then apoptosis. Alcohol increases the release of free radicals also, and that can lead to mitochondrial damage and can cause apoptosis. Okay, now another thing, gout. Gout, you know that it is the accumulation of uric acid. How does the gout occurs in alcoholics? The increased lactic acid production result in hyperlacticidemia. So this hyperlacticidemia reduces the capacity of kidney to excrete the uric acid, okay, which favors the accumulation of uric acid, and this leading to the secondary hyperuricemia and causes the aggravation of gout. Okay, and also it can lead to CNS depression because the alcohol can readily cross the blood-brain barrier and affects the functions of brain and can cause the CNS depression. Okay, so this figure which explain the fatty liver because of the high lipogenesis, promotion of lipogenesis, TG synthesis, etc., which promoting the accumulation of fat in the liver. That condition is known as fatty liver. Fatty liver, it is not treated, or if it is prolonged, that can even lead to cirrhosis of the liver. Now, effects of alcohol. Effects of alcohol, we know that we might have seen the alcoholic people surrounded by us. They have poor judgment, impaired judgment, amnesia, loss of memory, then anxiety, then increased urination. Then if you carefully notice, if if you observe a chronic alcoholic can be appeared as a red-faced people, that is due to the vasodilation, flushing, then disrupted balance, then hangovers, nausea and dehydration. So if you are taking organ wise, alcoholism and nervous system. Alcohol depresses the central nervous system. That means the alcohol shows or slows the rate at which the nervous system can function and communicate. It impair the central nervous system or depresses the central nervous system function. Because of that, it can lead to impaired judgment. And also in alcoholics, there will be polyneuritis occurs, that we have already explained with the thiamine metabolism. Consumption of alcohol will also cause increased self-confidence as well as decreased judgment. A very bad combination. Amnesia. Why amnesia occurs? The central nervous system is impaired. The process of creating and storing memory is also impaired because of the after effects of this alcohol metabolism. So all these can lead to short-term amnesia. Then coming to the cardiovascular system, alcohol actually is a blood thinner. Alcohol has lower density than water. The consumption and absorption of alcohol will reduce the thickness of your blood. So that means there is a plus point or positive point here. Moderate consumption of alcohol, that is less than 2 drinks per day by legal adults focus, that is legal adults, can actually improve the heart health by lessening the work required to pump the blood. Being a blood thinner, a moderate consumption of alcohol is actually good for the cardiovascular system. Thinning blood is easier to pump, but always remember, do not self-diagnosis. Do not do the self-diagnosis. Then coming to the hangover, another after effects of alcohol metabolism. A hangover is the ill effects experienced by excess alcohol consumption after the high intake of alcohol, and when this high feeling has worn off, the patient or the person may experience certain symptoms that is known as hangovers of alcoholism. Symptoms of hangover include fatigue, dehydration, nausea, and stomach irritation, headache, etc. So in this figure you can see so many symptoms including headache, dehydration, nausea, low blood sugar, then unsolvable predicament, etc. Okay, and these all are the hangover symptoms of alcohol metabolism. Now the long-term effects of excess consumption: tissue damage. Alcohol is an irritant to the mouth, throat, stomach, and can raise the risk of cancers to these structures. So this happens for when the long-term consumption of alcohol occurs. In that time, it can even irritate the lining of the alcohol wherever alcohol passing, that is our mouth, throat, stomach, etc., and can raise the risk of cancers to these structures. Then liver damage. Obviously, we have learned the metabolic derangement which happens in the alcohol metabolism. So, because of the accumulation of fat or fatty liver can progress to the liver cirrhosis, and all those can causes the liver damage. Why here the liver can be overwhelmed by the fatty acid, causing it to swell and lose its ability to filter the other toxins, and that can lead to liver cirrhosis. Then brain damage. Alcohol can permanently damage brain cells, particularly in brains that are still developing and maturing. That is why the alcohol consumption is very much dangerous to the youngsters. The brain does not finish maturing until the age of 20 to 25. So in younger age, the consumption of alcohol can cause a permanent brain damage. Now coming to the other points, weight gain. Obviously, alcohol has 7 calories per gram. After the metabolism of acetate, nearly 7 calories per gram can be gained. This is almost high as pure fat, which gives 9 calories per gram, and higher than that of carbohydrates, which will give only 4 calories per gram. Now, skin damage. The conversion of alcohol into acetaldehyde can cause inflammation to the skin. So, excess consumption will cause excess inflammation that can lead to the rupture of blood vessels in the skin, creating blotchy scarring. Then, finally, accidents, that is due to impaired judgment and loss of coordination and increased sense of confidence, is a deadly and all too often fatal combination. Now coming to the laboratory findings in chronic alcoholism. So you know what are the liver markers, AST, ALT and all. This level will be, specifically the ALT level will be very much high in alcoholism, and we know a specific marker, GGT, gamma glutamyl transferase enzyme. It is a specific marker for alcohol abuse, and there will be decrease in aldehyde dehydrogenase activity. And another newer marker of alcohol abuse is that dicyanotransferrin. These four are the parameters to be analyzed to find out the chronic alcoholism, especially GGT, gamma glutamyl transferase, alanine transaminase. Then these level will be highly increased, and also dicyanotransferrin level will be increased, and there will be a decrease in aldehyde dehydrogenase activity. So coming to the conclusion, what do you understood? Alcohol consumption is injurious to the excessive alcohol use causes serious health problems like liver cirrhosis, cardiovascular problems, neurodegenerations, etc. Besides this, many exhibit multiple problems such as antisocial behavior, depression, or anxiety, risk taking, specifically risky driving, gambling, etc. So the moral of the story is do not consume alcohol. Excess alcohol consumption can lead to dangerous effect to the human body. But our topic or our concern is not in that. We have to study those two metabolic reaction, alcohol dehydrogenase and aldehyde dehydrogenase reaction, and microsomal ethanol oxidizing system reaction, and how this high NADH level favors the biochemical alterations in alcoholism. So all those points to be studied in detail. The side effects of alcoholism you can just read, may or may not ask, but our focus is mainly on the metabolism and the biochemical alterations in alcoholism. Thank you. Thank you so much.